All right, we're going to get to the brain, get to ketones. But before we do, let's define metabolic dysfunction. Talk about
Hmm.
what that is, and then the
Yeah.
process that somebody goes down as they're heading that way.
Yeah. So metabolic dysfunction for a lot of doctors, and certainly the way I was trained, is whether or not you have type 2 diabetes. And if you're short of that, you're okay. And it sounds simplistic, but that's really how a lot of us were trained and practiced. But it's far more than that. And if you wait for type 2 diabetes, you've had metabolic dysfunction for years, if not decades. And it's really this concept of insulin resistance, right? So if you're looking just at blood sugar, our body has a pretty good system to try and keep blood sugar in check and keep it in a normal range. And that relies heavily on insulin. So we can use more and more insulin to keep blood sugar stable as our bodies become insulin resistant. So if we, needed X amount of insulin when we're healthy, as we get less healthy, maybe we need 2x insulin, but we can keep that glucose in the same level, and then eventually 3x insulin, 4x insulin, and then glucose is going to start to creep up, and then eventually you can't produce enough insulin. So metabolic dysfunction, being metabolically unhealthy, starts at that early stage of insulin resistance, when your body, it tends to be overweight, have too much adipose, and not responding as well as it should to the insulin signals to keep that blood sugar in a steady range. And sleep can affect that. Lack of exercise can affect that. Chronic inflammation can affect that. And of course, high carbohydrate, high sugar, high calorie diets can affect that, especially when you're overweight and have too much adipose tissue.
All right, you gave a nice explanation there, the fact that insulin's going to rise over time, maintain blood glucose, which alludes us to the fact that we can't rely on blood glucose over these years, that we're becoming more and more metabolically unhealthy. You talked about the fact that people will become overweight as they're heading in this direction, but what other things can people look at without testing? I want to get to testing after, but subjectively, to determine how far down they've gone towards type 2 diabetes.
Yeah, I mean, there are a number of different things you can do. I mean, your waist to height ratio is a very simple one. And you want that waist to height ratio to be under 0.5 to suggest less likely to be metabolic dysfunction, where if it's above 0.5, more likely to be metabolic dysfunction and insulin resistance. It's kind of a crude measuring tool, but it's actually fairly accurate considering how easy it is. Body composition tests is another big one. How much visceral adipose or VAT tissue do you have? What's the body fat percentage? And then lab tests like fasting insulin levels, hemoglobin A1C, and certainly a HOMA-IR, which is a calculation using a fasting glucose and a fasting insulin, or a glucose to triglyceride index, right? There are lots of different tests that you can do. And we actually have a guide on this at metabolicmind.org, and on our YouTube channel, that goes through sort of the diagnosis of insulin resistance, because it's not your standard blood test, right? It's not your standard fasting blood sugar, which is unfortunately one of the least helpful tests that is very popular to use to diagnose metabolic dysfunction, but is so unhelpful. And even something like a CGM is far better, because it tells you how your blood sugar is responding to your meals. And if your blood sugar is spiking to 170, 180, 200 and staying there for an hour and a half or 2 hours after your meals, that's a sign your body's not responding well to the food you're eating, and that you have this component of metabolic dysfunction and insulin resistance.
You gave a number of tests there. Somebody right now who's feeling like they're a bit overweight, they're likely insulin resistant or further down this path. What one test would you recommend if they want to definitively test to see if they're metabolically unhealthy?
Yeah, what one test? Oof.
Because you gave a few there, and people, I don't want them to feel overwhelmed, and it's already going to be a stretch for a lot of people when they go ask their doctor for some of these more quote unquote obscure tests. What
Yeah.
can they take to their doctor and get done to see where they're at?
I think if you're going to ask for one thing, it would be a fasting insulin, because everybody's going to get a fasting blood sugar. But the most important thing is what level of insulin is required to maintain that level of blood sugar. So if you get a fasting insulin level, which is a separate blood test that's not routinely done, unfortunately. That in and of itself is a helpful test, but then put together with your fasting blood sugar, you can calculate a HOMA IR. And that's not a separate test. That's just a calculation that's done by the lab or by your doctor. That is a fairly sensitive marker for insulin resistance. So I think that's probably the one thing you can do. But remember, you also, standard blood tests tend to get triglycerides and tend to get glucose. So that's another one you can easily do because most people already have the data. They're just not putting it together to look at the ratio or the index. Just make sure it's a fasted test, which is important for both the blood sugar and the triglycerides. So those are ones that are easy to do without an extra blood test. And like I said, as long as you can get that fasting insulin, that's a really good place to start. And there are others that you can do, but that's a good starting point.
Okay, coming back to the story, the piece of the story, blood glucose is trying to go up, insulin's going up and keeping that at bay. What's happening in the body, physiology-wise, as that's happening? Destruction that people might not tell as it's happening until it goes further down towards, say, type 2 diabetes.
Yeah. As insulin is chronically high, it can prevent you from accessing your fat stores and burning your fat stores for energy. So it's a good way to add fat to the body. Insulin is, it's signifying a fed state. If you think about evolution, it's like, okay, we've got a lot of calories, we've got a lot of energy, we've got high insulin. So we can actually start storing some of this because there's probably going to be a time later when we don't have it and we'll want to burn it. Problem is, in modern society, you frequently don't get to that stage where there isn't the energy around, so you don't get to access your fat store. So the first is you're building fat stores, not burning fat stores. The second is it can actually trigger a chronic inflammatory state. You can measure the relationship between hyperinsulinemia and inflammation, and they tend to really be correlated fairly closely. And chronic inflammation is something that really has multiple different cascades of what it can impact, from whether you're talking about the vessel wall, whether you're talking about organ function, right? It can impact a number of different aspects of your body, and theoretically can even worsen insulin resistance. So it's almost like a circular effect there. And then if the blood sugar does start to go up, then you can, or even before it starts to go up, if it's sort of sustained at a higher than average level or higher than normal level, I guess you can say, you get glycated end products. So you get glucose is deposited on more proteins or more cells, which can then also cause those to sort of misfunction, I guess you could say, is a simple way to do it. So there's a whole cascade of things that happen. And that's why, you can read the literature and see insulin resistance, metabolic dysfunction is associated with mental illness, with cognitive decline, with cancer, with heart disease. And you can say, how can one thing be, either causative or related to so many different things? And it's because of this sort of general cascade that it can start.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Metabolic dysfunction for a lot of doctors, and certainly the way I was trained, is whether or not you have type 2 diabetes. And if you're short of that, you're okay. Metabolic dysfunction, being metabolically unhealthy, starts at that early stage of insulin resistance. When you're